Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome and thank you for joining our weekly Redefining Medicine podcast. Today we're joined by Dr. Stephen Sinatra. With over 40 years of clinical experience, Dr. Sinatra began his career as an attending physician at Manchester Memorial Hospital in Connecticut, where he went on to serve as Chief of Cardiology, Director of Medical Education, Director of Echocardiography, Director of Cardiac Rehabilitation, and Director of the Weight Reducing Program. Dr. Sinatra is also founder of the New England Heart Center and has become a highly sought-after cardiologist, well known for his integrative approach to treating cardiovascular disease. Thank you for joining us today, Dr. Sinatra.
Oh, it's great to be here, Lindsay, and thanks so much for that nice introduction.
Thank you. I'm excited to get started. Dr. Sinatra, what clinical advances, practice updates, and or general career updates have been most impactful for you since you last spoke with us in 2018?
Oh boy, that's a great question, and it has been considerable. You know, one thing about cardiologists like myself, especially cardiologists who are involved in integrative cardiology, in other words, bringing alternative methodologies to the table, is that we are privy to family history, for example. We would ask questions about family history, about early sudden death or an early myocardial infarction. And what the Biogenome Project discovered in the 1990s, and you know, three doctors actually won the Nobel Prize on it, but it's taken about 20 or so years or more years to realize that there are genetic variants that we carry that really, are the genesis of illness and disease. And again, a cardiologist like myself, we were privy to that. For example, if you possess the APOE4 allele, this was something that could, lead to Alzheimer's disease, for example. I mean, people were more prone. If you had hypercholesterolemia, these genetic variants, we were privy to that. We were also privy to homocysteine. And again, genetic variants where, people, let's say in Northern Canada or from Ireland, from, the European descent, you couldn't metabolize folic acid that well. So as a heart specialist, when the genetic, let's say, storm occurred, when everything got reshuffled, and now everything's alphabet soup, AMPK, PARS, this and that, it's unbelievable. But when I go to conferences now, the genetic variants are really key. And again, we were privy to that in the practice of cardiology. So I think genetic testing is a game changer. I think doctors of the future will be testing your whole genetic profile. And wherever you have weaknesses in that profile, it's going to be like putting a finger in a dike. In other words, we have remedies, whether they're pharmacological remedies or nutraceutical remedies, to really plug up the weaknesses in your genetic profile. So I think genetic medicine is the medicine of the future. And we've been doing it, but we've been doing it unknowingly. Let me give you an example, Lindsay. When I first spoke at the A4M over 25 years ago, a lot of the docs there were taking metformin. And it's true. I mean, metformin is awesome. I mean, it's a great anti-aging medication, or let's say, because the reason why it works, it has an impact on glucose metabolism. And we know that in the country today, there's about 100 million diabetics. And, whether they're type 2 or insulin dependent or have insulin resistance, it doesn't matter. But higher blood sugars are the norm, and even the medical societies have reduced the fasting blood sugar down to 70. It used to be 100. But it's just incredible. Now that we learned about genetics and about AMPK, for example, which is an enzyme involved in glucose and fat metabolism, if you use an AMPK stimulator or something that supports AMPK, like berberine, for example, a nutraceutical, now my colleagues and myself, we're all taking berberine. It used to be metformin, but now because of the genetics and what we're learning about genetics. So in the last 3 years, I have to tell you, medicine is changing. It's unbelievable. And the doctors of the future are learning it. And the doctors of yesteryear, like myself, we have to keep up with the future. That's why going to conferences, especially the A4M conferences, is vitally important, just to keep up with the data, the literature, and what's happening in medicine.
Thank you, Dr. Sinatra. You are currently working on a book covering high vibrational living. Can you explain what is high vibrational living?
Yeah, this is something that I've been interested in for over a decade when I was working with energy medicine. I was working with certainly grounding, which is a form of energy medicine, and was working with a lot of different types of machines that were developed in Germany. And I went to Canada and Montreal, and energy medicine is really the field of the future. When we combine it with genetic medicine, it's really incredible. When I was preparing my book to talk about high vibration, I realized that it's really the vibration of cells. In other words, the higher the vibration, the higher the voltage of a cell, the healthier it is. And what do I mean by that? Well, if a cell can take in nutrients because of its high, let's say, electrical charge, and expel waste products, that's nirvana. That's what you want. In other words, you want your cells to take in nutrients, expel waste products, and you want it working at a high voltage. And what MIT researchers showed a few years ago was that if you indoctrinated cells with, let's say, a malaria infectious disease variant, the voltage of the cells went down. And the more the voltage of the cells went down, the more pathology and illness was expressed, with voltage. So high vibrational living is really supporting your cells with energy to keep the ATP, adenosine triphosphate, is like our prana, it's like our chi. And whenever you drive ATP in a preferential direction and develop more energy, your cells will vibrate more. And I feel that high vibrational medicine, and there's lots of ways of getting those cells to vibrate. I mean, whether it's nutraceutical, mind, body, earthing, grounding, there's so many ways to get those cells, or detoxification. Whenever you detoxify a cell, the cell breathes more. It breathes more in nutrients. So whenever you get that cell to work optimally, you're bringing health and wellness to the table. And that's what high vibrational living is all about. And I'm excited about writing this book because I think over my 40 plus years of practicing cardiology, I'm learning more and more about the nature of cellular activity and what that brings to the table. And I'm very, very excited about it.
Thank you. Can you comment a little more on the role of nutrition and high vibrational living?
Yeah, well, there's a lot of nutrients that can actually stimulate the cell, the energy processes of the cell, by driving adenosine triphosphate. For example, we know that D-ribose is the center of the ATP molecule. If you look at ATP, the energy of life, the chi, the prana, the breath of God. That's what the Hebrews used to talk about it. I mean, it's amazing what this energy is. But you have a purine ring, which is basically ribose. It's a 5-sided sugar, and then you have an adenine ring, and then you have 3 phosphate groups. So it's the cleavage of that 3rd phosphate group when ADP, adenosine triphosphate, and ATP, adenosine triphosphate, the cleavage of that 3rd phosphate group runs the machinery of our body. It happens, gazillions and gazillions of times per second. So basically, whenever you bring this energy, and especially in cardiology, because even prehistoric man realized that life depended on a pulsating heart. So in other words, whenever you get that pulsation energy expressed into the cells, and especially into the heart, whenever that energy is expressed, again, you're getting the optimum living potential out of the organism. So I just feel nutritional status is just so important in the energy framework of our cells. So that's why I developed metabolic cardiology, because in metabolic cardiology, you're using D-ribose, again, that center of the ATP molecule. You're bringing carnitine, which shuttles fats into the mitochondria. We've got to remember, it's fats that is in the mitochondria that is burned as energy. But more importantly, when those fats are burned, the toxic metabolites need to be shuttled out, and that's what carnitine does. It acts like a ferry boat. It brings the fats to be burned in and the toxic metabolites out. You bring magnesium in there, and magnesium is the glue that holds everything together. It's involved in 300 enzymatic reactions. And then there's coenzyme Q10, which is really the miracle nutrient, that it's the spark plug for igniting this whole ATP process. So for me, I mean, metabolic cardiology is one of the things I think I'll be remembered for. I coined the term, over a decade ago. And it's been metabolic cardiology that literally has saved thousands and thousands of my patients. And that's no exaggeration. And I have to tell you, Lindsay, when I saw pediatric children waiting for heart transplants who were dying, and I had parents in my office who were crying their eyes out. They would have a 9-year-old, a 12-year-old with heart failure, congenital heart disease, previous surgeries. They can't find a heart because, there's not enough hearts to go around. And I treated these young children with a metabolic approach, and again, driving the energy of life into the direction of sustaining the pulsation of the heart. A lot of these children have refused heart transplant now because they're living into their 20s and 30s. I mean, I have the oldest single outlet ventricle in the world right now, who's in his early 30s, when without a heart transplant, you would be, you wouldn't make it. So one thing I know about metabolic cardiology is that something about metabolic cardiology, when it's driving, the ATP in the direction, I think the ATP is connecting with exosomes in our body as chemical messengers that are stimulating our intrinsic stem cells to redevelop new heart cells. So if you have a massive heart attack and you're 35 years old and you go on metabolic cardiology program, well, you might grow new heart cells and sustain that massive heart attack where you had a diminished function or a diminished ejection fraction of the heart. And I've seen this hundreds of times over the years of my practice. So I'm really thrilled about metabolic cardiology and what it's done to sustain life in people.
You've noted the challenges of nutritional health with so much of our food adulterated with GMOs, chemicals, heavy metals, and sugars. How do you approach this challenge with patients, especially given the additional economic challenges many face in accessing unadulterated foods?
Yeah, that's a great question, because people don't realize the impact that foods have on our metabolic machinery, and especially the pathology in our body. I mean, first of all, there's so many foods that are adulterated with genetically modified organisms. I mean, this is frightful. In Western Europe, for example, GMOs are kept out. I can tell you that. And basically, the food supply is very, very toxic. I mean, arsenic in rice, for example, is frightful. Heavy metals, insecticides, pesticides, BPA, bisphenol A, which causes sterility in women. I mean, our food supply in so many ways is the source of illness and pathology in our bodies. I mean, that's why I developed my website Vibrational, because, at my age, I mean, I don't need another business, believe me. I mean, I've been involved with vitamins and minerals and nutraceutical supports for years, but, we use nutraceutical supports to plug up deficiencies, mineral and vitamin and enzymatic deficiencies in our body. But you should really get those from eating whole foods. You really should. But the problem with eating whole foods today is that you're not getting that nutritional support. Case in point, magnesium. The soils are so depleted in magnesium that this is one mineral that everybody should be taking every day. I mean, I brush my teeth at night like everybody does, but when I rinse my mouth out, I chase down a couple of 100 milligrams of broad spectrum magnesium, because I realize how important magnesium is in igniting the metabolic processes in the body, because it's involved in so many, it's hundreds of enzymatic reactions, like I said before. So I think bringing healthy food to the table, organic, non-GMO food, is extraordinarily important, because remember, It's healthy foods, and again, additional vitamin and mineral support, because you want to make up any deficits that you're not getting in a healthy food supply. And that's why I just feel that we have to limit the chemical and toxic environmental exposure on our body, because insecticides and pesticides and heavy metals are literally poisoning the enzymatic machinery of the body.
Dr. Sinatra, I understand you've been doing a lot of TV interviews about COVID-19. What's the most important piece of advice you want to impart to your audience about COVID?
Yeah, COVID is a real interesting illness. First of all, it's very damaging. When COVID enters the sinuses of the nose and the mouth, it locks into the lung. We call it the ACE2 receptor. And these receptors, once the virus locks into that receptor, it causes damage. That's why a lot of people develop pulmonary failure, for example, because it sets up what we call a cytokine storm. These are inflammatory mediators, and it causes hemorrhage of cells. Now, we have ACE2 receptors in the brain. That's why some of these people have developed bleeding in the brain, ACE2 receptors in the gut. People with COVID get nausea, for example. There's ACE2 receptors in the kidney. Some of these cases present with renal insufficiency and even renal failure. So when it comes to COVID-19, supporting the immune system is vitally important. Case in point, take Coenzyme Q10. Now, this has not been written up in the literature with COVID, but COVID causes what we call endothelial cell destruction, leading to hemorrhage. Now, one of the best nutraceutical supports in preventing endothelial cell destruction is Coenzyme Q10, because it supports the endothelial layer. Now, one thing about Coenzyme Q10 that's very remarkable, it inhibits the inflammatory mediators like NF-kappa B, which is involved in the cytokine storm, as well as interleukin 6 and C-reactive protein. So when you have a remarkable nutrient that drives the energy in the right direction while inhibiting inflammatory mediators at the same time, I think Coenzyme Q10 is going to be vital. And somebody will do that research, with inflammatory pneumonias or inflammatory viruses like COVID or SARS or even Ebola virus, for that matter. Now, there's been some research on vitamin D. Vitamin D is amazing. I have to tell you, this is a very, very inexpensive nutrient. People living south of Atlanta, for example, may have more vitamin D, higher blood levels than people living north of Atlanta. So if you draw a line from Vancouver, Canada, down through Atlanta, people living in Minnesota or in Connecticut or in Illinois may have lower vitamin D levels in the blood, but people in Florida may have higher vitamin D levels because they're going out in the sun. Remember, when sunlight hits the skin, it's the cholesterol in the skin combined with natural sunlight, UV light, that makes vitamin D3. So you need cholesterol in the skin with UV light, and you form vitamin D3. However, people in Maine and Massachusetts can't go out, in the wintertime, and they don't get the vitamin D. There was a recent study that showed that if your vitamin D levels were low, like 10 to 15 UGs per ml, and if you caught COVID-19, you are very prone to not only complications, but to dying from the illness. However, people with vitamin D levels of 30 to 40, which is sort of high normal, the mortality was like minimal, if not zero. So I think vitamin D is really an unsung hero. It's inexpensive. And right now, I would tell our listeners to take a minimum of 4,000 to 5,000 units a day, especially during this pandemic. I mean, I take 5,000 units every day, and sometimes I even boost it up to 10,000 units. But that's myself. I mean, I really believe in nutraceutical support. I believe in zinc as well. I think zinc is really something that's, again, inexpensive. Taking 20 to 40 milligrams a day is good. For men, it's also good for the prostate gland. For women, again, I think it's vital in closing the doors of our cell, where it can help prevent the cellular replication or cellular viruses going into the cell. I like vitamin C, especially if it's combined with liposomes. I really like glutathione, selenium. I mean, there's so many nutrients I like going forward in helping to give more resistance to COVID complications while supporting the immune system at the same time.
Dr. Sinatra, you led a lecture titled The Role of Coenzyme Q10 in Cardiovascular Disease, Hypertension, Dyslipidemia, Diabetes, Coronary Heart Disease, and Congestive Heart Failure during a recent module. Can you provide a brief overview of this presentation and a few key takeaways?
Yeah, I'll tell you, Lindsay, another great question. There's been an explosion of CoQ10 in the literature. I mean, I was so grateful for the A4M to ask me to speak about CoQ10 because I've been using it for over 40 years in my practice. And when I reviewed the recent literature, the 2020 literature, I was amazed about all the articles that came out. And there was one article that came out only a couple of months ago in November. It was entitled, there was a review, Coenzyme Q10, Novel Formulations and Medical Trends. This was an amazing paper because not only did it discuss the cardiovascular ramifications, which I was very privy to, and, just to give you a couple of bullets, CoQ10 is an ideal and a very, very safe nutrient. The body makes it. It's made by the cells in the body. But we need a lot of it, especially if we have any pathology, because CoQ10, like melatonin, is used up, for example, to combat, UV light. And when you're exposed to UV light, let's say, the damaging effects of overexposure to UV light, melatonin and CoQ10 are gone in the skin. 15 minutes to a half hour, they're gone. By protecting, just the body from UV light. But one of the things about CoQ10, it's so safe and it's so well tolerated. I mean, very rarely did I hear complications about nausea or diarrhea. I mean, it happens maybe 0.5% in people. Can people develop too much energy from CoQ10? Yes. Yeah, I saw it basically in a elderly rabbi. He was only about 90 pounds, suffering from heart failure. And I gave him very low dose CoQ10. And he used to tell me, doctor, my heart skips, it palpitates. And then I had to treat him naturally with food substances that contain CoQ10. And I eventually got him up to 10 milligrams or 30 milligrams, in capsules. But it's so well tolerated. It attenuates cardiovascular risk factors. It's amazing. And it supports endothelial function and myocardial cells. And again, it drives ATP, the turnover of ATP, which is really the essence of life. It reduces oxidative stress. It reduces inflammation. It mildly reduces blood pressure. That's kind of cool because high blood pressure, because of the pandemic, is soaring right now because of emotional stress. So whenever you have emotional stress, you're overdriving the sympathetic nervous system, and that causes blood pressure to soar. And CoQ10 has a nice impact on lowering blood pressure. It improves insulin resistance, which is epidemic in our society right now. And it attenuates arrhythmia in the cardiovascular system, and it supports quality of life, especially in patients suffering from heart failure. But then this paper not only talked about the cardiovascular ramifications, but it talked about the non-cardiovascular ramifications. And I got to tell you, Lindsay, I think I mentioned this at the A4M meeting, but I have a family history of diabetes, and I'm not diabetic, probably because I've been taking CoQ10 for 40 years. But my grandmother and mother both went blind because of glaucoma. And I have 3 siblings and myself, and we've all been taking CoQ10 for 30 to 40 years. And none of us have high intraocular pressures. Now, I didn't understand this. I know glaucoma is involved in family histories, especially with retinal deterioration around the retinal nerve. But then this paper discusses that in glaucoma, and if you have it, and if you're taking coenzyme Q10, you can prevent the side effects of glaucoma. And I didn't know that. I just learned that only a couple of months ago. And here I am, a board certified cardiologist, reading all the literature on coenzyme Q10. So these were surprising conclusions the non-cardiovascular CoQ10 supports. And that's whether you're suffering from Alzheimer's disease or pre-Alzheimer's. CoQ10 is great for the brain. It can prevent Alzheimer's. It prevents epilepsy, or it supports epilepsy. It supports Parkinson's disease and Huntington's chorea. In other words, you get less complications. I talked about dementia. Now we're using it in Down syndrome. In fact, that was one of the clinical usages of CoQ10 only just a few years ago. We're using it in migraine. This is incredible. A lot of people suffer migraine headache. And what we've learned is that in migraine, there's peaks and valleys of CoQ10. And when people suffer migraine, your magnesium and your CoQ10 levels drop in the body. But if these people take magnesium and CoQ10, they can prevent migraine. So that's incredible. And then the most incredible thing about CoQ10, like I mentioned before in COVID-19, is that it gives us tremendous immune system report in down-regulating those inflammatory mediators while supporting endothelial function at the same time. Whenever you do that, you sequester or you help prevent the complications from COVID-19. So I'm all in on Coenzyme Q10, especially in 2021.
As a certified bioenergetic psychotherapist and cardiologist, you have a unique perspective and approach to care. You've authored a book titled Heartbreak and Heart Disease and have affirmed that emotional stress is a principal aspect of heart disease. With that perspective, what do you believe are the implications of the relationship between emotional stress and heart disease during this period of deep uncertainty, politically, economically, environmentally, and medically within the United States and beyond?
Yeah, that's a good point, Lindsay, because what I learned as an early psychotherapist, I studied Gestalt psychotherapy after I became a board certified cardiologist, because I thought there was a connection between the heart and the brain, especially emotional stress. And then when I was an early, again, board certified cardiologist, I was doing hundreds of angiograms. I say I did over 3,000 in my career. But I'll never forget it. I was treating people at Pratt & Whitney and the Groton subbase here in Connecticut and Colt Firearms. And I was treating aeronautical engineers. And when they were losing their jobs because the Vietnam War was wound down, I was seeing intense emotional stress in these young men. And I was literally performing angiograms on men younger than myself in their mid-30s. I was in my late 30s. And I'm saying, how can this be? And I realized that when a male, especially like a highly trained PhD aeronautical engineer, loses his job, they can't find another job, and because they're so highly skilled, and the despair and the depression and just the shame of not working, these men became dreadfully sick, and it really bothered me, because again, I was in a Gestalt training program. And I decided to become a certified bioenergetic psychotherapist. I realized that the mind body, the heart and the brain talk to one another, and there's chemical messages going on, and back and forth, adrenaline, noradrenaline, which literally sets the cardiovascular system. It's like driving a car with your brakes on. You have all these hormonal discharges, and from emotional stress, and basically, I was seeing these hypertensive males and then eventually females. And that's why I became a certified. I spent another, after spending, years in internal medicine and cardiovascular disease, I spent another 10 years in Gestalt and bioenergetic psychotherapy, becoming certified as an analyst, trying to work with people. How do you deal with these emotional upheavals? And it's going on today. We're seeing more suicide. We're seeing more depression. We're seeing more, heart attack, because, people are clamped up in their homes. They're not working. There's a loss of self-esteem. There's depression. So basically, what do you tell these people? I mean, what's the answer? Well, I can tell you this, because I've published this in the literature. I've done workshops on this. I think the most important thing about discharging the overactive sympathetic nervous system is to cry. Crying will release the heartbreak that can lead to heart disease. But a lot of men don't cry, and a lot of women who are working in the workplace, don't cry because, it's unfortunately it's a stigma, it's a show of weakness. But if you want to prevent illness, you must validate that weakness that we all have, because crying not only reduces endorphins, in the eye, which are the feel-good chemicals, but crying, whenever we breathe more, when we sob and we cry, we're having an impact on thromboxane A2 in the lung, and we're literally making the blood thinner. And I have to tell you, I just feel that whenever you can reduce this emotional turmoil in the body. Now, a little anger is good, crying is good. You don't want to kick the cat, or you don't want to go into rage, because that's uncontrolled anger. You can hurt somebody. But I think during the epidemic right now, having our emotions out and feeling the deep sadness about the loss of a job, or the loss of income, or the loss of self-esteem, just having that sadness, the dividend is that it can get your heart back. In other words, you can help prevent a catastrophic event, because I just feel, and that's so important. And by the way, I've done research on this, running workshops. I'll never forget, we ran a workshop and we measured stress biochemicals in the urine. And when we broke the codes in the workshop, the women who cried and held one another, and they hugged one another. And when we broke the codes, they had no stress biochemicals in their urine. And then when we broke the illness codes, none of these women were sick. It was incredible. They didn't have heart disease. They didn't have high blood pressure. They didn't have hypercholesterolemia, no diabetes. But then the men, when we the men were like this during the workshop, like they were like lumps of clay. They didn't have their emotions. I would ask them, well, how you feeling? Fine. I said, really? You feeling fine? Yeah, doc, this is nothing. I can get through this. And then when we broke the codes on the men, they all had heart disease. It blew me away. And they had astronomical levels of noradrenaline and adrenaline in the urine. And, the body speaks the truth. From here up lies. And when I saw that data, I said, oh my God. I said, men who don't cry get heart disease. And guess what, Lindsay? That was my own issue. That was my issue. And I said, uh-oh. I said, I'm going to get heart disease. So I I ended up going into personal psychotherapy, working with some of the world's best therapists. I have to tell you, after, I published that paper, I couldn't cry even working with psychotherapists, but I saw a movie with Gene Hackman in it called Hoosiers. And that movie touched my sadness. And I cried at the end of the movie, and I realized how therapeutic it was. I ended up seeing it 5 times. And I realized that, that movie touched my own, high school wrestling days and the David and Goliath stories and stuff like that. It touched the inner sadness in me. And that movie was just incredible. And I always recommended, any movie that you go to that touches sadness, or, and people say, oh, the movie made me cry. Lindsay, no, the movie didn't make you cry. It just touches the sadness that we all have in our bodies. And when you see a movie that touches sadness, the healthiest thing to do is to cry and cry and cry it out. Because when you do that, you're discharging the body of toxic biochemicals that can lead to actually illness.
Thank you so much for those takeaways, Dr. Sinatra. This is a perfect segue. How are you ensuring your own emotional health and well-being? And what advice would you offer clinicians who are having a difficult time navigating this season?
Yeah, I would first tell clinicians to be really honest with people as best they can. I mean, honesty is really the best policy. I mean, just tell the truth. Whether you're a physician or a politician, I mean, I think the truth works. And I think the physician needs to be a role model, because patients will, physicians are like parents, Lindsay. Like a child will follow what you do, not what you say. I can tell you that as a psychotherapist. So if you're in a family that, smokes, for example, your children are going to smoke, going to follow what you do. If you're in a family that prays before a meal or goes to synagogue or church or something like that, that child's going to do the same thing. I mean, children follow what you do, not with what you say. And it's the same thing about a physician or a health provider. If the client or if the patient knows that, as a physician, you practice what you preach, you follow a good diet, you take vitamins and minerals, you practice mind-body medicine, and you go to see that doctor, those patients are going to get it. They're going to get it. It's unbelievable because the most important thing in the physician-patient relationship is that the physician needs to see the patient struggle. And they need to not only see the struggle or the suffering in their patient, but they need to resonate with it. So they do a dance, so to speak. If the physician sees that struggle and resonates with it and can do a dance with the patient, with them, if the physician acknowledges the struggle, he or she can be a very effective healer in supporting the patient, through their, perils of having an illness. And they can do that in so many ways. Like I said, being a role model is key. A non-inflammatory diet is really important. I mean, I've been on the radio and TV talking about sugar, especially with COVID-19. Remember, whenever you're taking carbohydrates or sugar, you're going to stifle the activity of white blood cells for hours. We call that phagocytosis, and you need killer cells, to fight this virus. So sugar, that's one of the reasons why being a diabetic or having insulin resistance or being overweight, for example, these are serious comorbidities. And diabetes is probably the worst comorbidity because, again, with higher blood sugars, your white blood cells aren't effective as natural killers of the virus. So a non-inflammatory diet, higher healthy fats, higher amounts of protein, less amount of carbs is key. I like targeted nutritional supports. We talked about them, and I just feel I bring a lot to the table. Detoxification is important. I mean, I was in the grocery store the other day, and they had these beautiful artichokes. Artichokes are probably the most important vegetable in detoxifying the liver. They have so many bioflavonoids and flavonoids in them. When you eat those leaves and eat the heart of an artichoke, you're supporting your liver. And, non-alcoholic fatty liver disease is epidemic in our society today. I mean, thank God Coenzyme Q10 is an antidote for that. But I have to tell you, the flavonoids from artichoke is an incredible liver supporting nutrient, as is milk thistle. Milk thistle is another one. And I think especially with COVID-19, you want to support your liver. So I'm all in on artichoke and milk thistle. I also like NAC, for example, acetyl carnitine. Remember, when we take acetyl carnitine or N-acetyl carnitine, like NAC, for example, or acetyl carnitine, that's not a derivative of NAC, but at least acetyl carnitine, gets into the blood-brain barrier. But N-acetylcysteine is broken down to glutathione in the body. So when you take N-acetylcysteine, now that combines with glutathione. It's broken down to glutathione. So if you're taking vitamin C and a little bit of selenium, now you're forming glutathione peroxidase, which is the most important, nutrient in not only preventing heart disease, but it's the most important nutrient supporting the immune system. So N-acetylcysteine is good. And acetyl-L-carnitine, again, for crossing the blood-brain barrier, we can reduce inflammation as well. So any form of detoxification is good. I love a far infrared sauna. I love sweating. When I work out in my basement, I like to sweat. I even do the foot baths. I mean, I learned about the foot baths at the A4M, 20 years ago. And I think that brings a lot to the table. So I think detoxification is key. And I love earthing and grounding. I mean, it's amazing, Lindsay. But walking barefoot on Mother Earth is incredible. Walking barefoot is like taking Coenzyme Q10 in a way. They're both synergistic. They both drive ATP in the right direction. And remember, whenever you're grounding to Mother Earth, you're easing, you're putting out the fires of inflammation. So, whether you sleep grounded or walk barefoot, I just love it. And I should end on this. I mean, I've published loads of research in the literature. I've written many, many white papers over, dozens and dozens of white papers, clinical papers, over 20 books. But when I did the research on earthing and grounding, and we showed that it thinned the blood, I thought that was the greatest research I've ever done in my lifetime. In fact, I spoke to guys at the institute in Sweden, Ali Johansson, and he's laughing at me, and he's saying, you wrote the greatest, literature about blood thinning I've ever read. But he says, you'll never win the Nobel Prize on this because nobody will ever believe it. And he was laughing and laughing. I go, Ali, how can you be laughing? This is the greatest research I've ever done. I spent, decades in cardiology. I'm a reviewer for journals. I sent this article to the top journals in the world, and they all refused it. And he continued to laugh, and he said, you know what? It's too far out. It's like believing in the world is flat instead of being round. And, I got it. But to me, it was so simple, Lindsay, because if grounding thins the blood, and if red ketchup blood is a sine qua non risk factor of causing clotting, I mean, that's what COVID-19 does. It clots the blood. It causes hemorrhagic, blood in the blood vessels. It causes endothelial cell dysfunction. So if you have red ketchup, clumpy blood, and now you can make it like red wine, with earthing and grounding. And that's what we showed, in the literature. It just makes sense to just, put bare feet on Mother Earth, because you can absorb all those electrons through your skin. And remember, the K1 point is in the foot. That's an acupuncture point that goes all the way up to the brain. It's involved in the spinal cord. And that K1 point, literally, you'll be driving in energy through your foot, but it's discharged into the brain by the pineal gland. So I just feel that earthing and grounding is a gift, and it's free. It's free, and you can heal for free. So I would really close on that, as something that you could bring to the table. And I think it'll make an impact in COVID-19. I think hopefully someday will do that research as well.
Well, thank you so much, Dr. Sinatra. So many great takeaways there. Always appreciate your time. Always appreciate you sharing your expertise with us. We do look forward to seeing you in the future.
Okay, it was great, Lindsay. And, one thing about being a doctor, you really learn in your 70s. This is amazing. This is incredible. And I want to encourage all the anti-aging docs, do not retire. Do not retire. And I've said this at many of the anti-age conferences, 70 is the new 50. And it is. If you follow the information that is given at the anti-aging conferences, I think a lot of my colleagues are going to be in their 70s and 80s still lecturing. And I just feel that these older docs can bring a lot to the table. And hopefully the younger docs will carry the torch and, really make a lot of people less sick, and they can reduce their pain and suffering, which is really the hallmark of being a good clinician. So thank you, Lindsay. This was a pleasure, and I was really happy to do it.